Because if my cephalic index is off, then my BPD will be below if it's dolicho. It'll be above if it's brachy. Okay? And it's gonna, is cephalic index on here? I don't even see it on there. Is it on this next one? No, it's not on that one either. But it'll have the cephalic index on there. So, and here's the OB report. The abdominal wall is good, the stomach's good, the right kidney, the upper extremities, the spine, bladder, left kidney, lower extremities, those are all good. Biophysical profile. Biophysical profile is an exam done in maternal fetal medicine that you test 5 different things. And you either get a score of a 2 or a 0. There's no in between. Okay? If this number is low, then they're going to look at that baby more closely. If it's critically low, they're going to put her in the hospital. Or they're going to do a delivery right then. Okay? And that's a biophysical profile. It's a 30-minute timed exam where you look at the heart rate. Is the baby moving its arms and legs? Is the baby breathing? So many respirations per minute. Are the hands moving? That's a tone. Is the baby doing a sucking motion? Is it sticking out its tongue? Is it moving its fingers? This is a movement. This is a tone. Okay? Okay, and then we total all those up. Now, you either, and so 5 times 2 is 10. If it's 8, they're going to do something. If it's 6, they're going to do something else. If it's a 4, they're going to do something else. If it's a 2, they're going to, the baby's almost dead. Okay, they're going to deliver it. Okay? We're going to study that later on. We've already kind of talked about this as far as the graph that we go on. These are the weeks, and this is the estimated fetal weight in grams. Up here is macrosomic. Down here, it's called small for gestational age. This is called large for gestational age. LGA, SGA. Large for gestational age, small for gestational age. And you're going to see that on your requisitions. Okay? We're going to study later on that if it's in the 10th percentile, see this is 1,000, so 10 is going to be around here. If you have a mark down here, you have an IUGR. And an IUGR, those babies are at risk. As much as the 90 percentile. 90 percentiles, those babies are at risk also. 90 percentile and higher. Okay. My patient's laying there. I'm a new sonographer. And then I noticed my patient doing this. Okay, so what's happened, if you do that, immediately roll the patient to their left-hand side. Don't roll them towards you because they're going to throw up on the machine and they're going to throw up on you. That's because the baby is putting too much pressure on the IVC and the aorta, and she's not getting enough oxygenated blood back to her heart. Okay? Don't even ask a question. Just take the sheet, whoop, flip them. Because they're... and you will move fast. Because the first time you get thrown up on, you will never let it happen to you again. Okay? What happens? You pay attention to your patient. Sometimes if you just get a wet rag, or just take them a little bit and put them LPO. What is LPO? Left side touching the bed. Okay? Believe me, don't do them RPO. They're going to throw up on you, and you're going to get vomit in your keyboard. Roll them away from you. Okay? So if you hear your patient, or you watch your patient being uncomfortable, this is what's happening. They can sweat, they get nauseous, some of them can even faint on you if you're not paying attention. Another thing, if you're pressing too hard on the baby, some people have a light touch when they scan, some people have a very hard touch. You can stop the baby's heart just from the compression of the transducer. Be careful. Okay? Here we've already kind of talked about this a little bit, a large patient and an average patient. Some little bitty thin patients, we can even go up as high as a 7. And a 7 is going to give us better contrast than the 3.5. We want to make sure that we pay attention to our depth, the focal zones, the sector width. Okay, so we want to make sure that we're running our machine to its optimum measurements. They don't know of any measurements, of anything harming the baby, but we don't want to take any chances, right? So always practice your Alera. Okay, so we're going to review this a couple of more days because we're going to go over some of these. Oh, I guess I left it in my other room. What time is this class over? 10? Okay. So any questions on what you have to do for an OB scan? Okay. So let's go over some protocols. Protocols are different. Oops. I'll just come back over here. Okay.
Do you not like using that board?
Huh?
Do you not like using the board, this board?
No, because it's too much stuff over there. Okay. Transabdominal, first trimester. First trimester. I'm going to do uterus with and without measures. I'm going to do right ovary with, without measure and color. Left ovary with, without measure and color. Corpus luteum. Oops. Corpus luteum with, without measure and color. Okay? With and without measure. I'm gonna do gestational sac with, without measure, color. Yolk sac with, without measure, color. I'm going to do heart rate. Okay? Not power, M mode. And then I'm done. Okay? It's the exact same for transvaginal, except for now, I'm gonna do inferior, superior, medial,
lateral.
lateral. Inferior, superior, medial, lateral. Okay, and that's it.
What if sometimes we cannot find both ovary?
Adnexa.
Just put adnexa.
Yeah, just put adnexa. Okay? Oh, I forgot that, didn't I? Okay. You'll do right and left adnexus. With and without color.
Is that supposed after the ovary ring?
I don't know, I didn't write them in order.
Oh, okay.
Okay? You're gonna do it on protocol. I just did it because I need you to know what you're gonna be doing. Okay? This is not in protocol.
Oh, okay.
Okay? Got it?
Yep.
Transabdominal, everything's in blue. Transvaginal, everything in blue and what's in red and green.
Green.
Okay? It's close enough. I only have 1 minute left. Oh, it goes there.
It's alarm.
Uh-huh. Yeah, let me turn this off. Yes, ma'am?
So we had a patient, who was 36 weeks, and she recently had her left ovary removed